Hello, and welcome to our channel. Today, we are going to be discussing 10 popular questions about pernicious anemia, a type of anemia that affects the production of red blood cells due to a lack of vitamin B12. We will be covering everything from symptoms and causes to treatments and prevention. Make sure to watch until the end and don't forget to hit that subscribe button to stay updated on our latest videos. What is pernicious anemia? Pernicious anemia is a type of anemia that occurs when your body is unable to absorb enough vitamin B12 from your diet. This deficiency can lead to a decrease in the production of red blood cells, which can cause symptoms such as fatigue, weakness, and shortness of breath. In addition to these symptoms, pernicious anemia can also cause neurological problems such as tingling in the hands and feet, difficulty walking, and memory loss. If left untreated, pernicious anemia can lead to serious complications such as heart disease and nerve damage. What are the symptoms of pernicious anemia? The symptoms of pernicious anemia can vary from person to person, but common symptoms include fatigue, weakness, and shortness of breath. Other symptoms can include pale skin, dizziness, rapid heartbeat, and difficulty concentrating. In addition to these physical symptoms, pernicious anemia can also cause neurological problems such as tingling in the hands and feet, difficulty walking, and memory loss. If you are experiencing any of these symptoms, it's important to speak with your healthcare provider as soon as possible. What causes pernicious anemia? Pernicious anemia is caused by a lack of vitamin B12, which is essential for the production of red blood cells. There are a few different reasons why someone might not be able to absorb enough vitamin B12, including an autoimmune condition where the body attacks the cells that produce a protein that helps with vitamin B12 absorption, or surgery that removes part of the stomach or small intestine. Additionally, a strict vegan or vegetarian diet can also lead to vitamin B12 deficiency and pernicious anemia. How is pernicious anemia diagnosed? To diagnose pernicious anemia, your healthcare provider will likely start with a physical exam and blood tests to check your red blood cell count and vitamin B12 levels. If your levels are low, your healthcare provider may order additional tests such as a bone marrow biopsy or endoscopy to determine the underlying cause of your deficiency. It's important to work with your healthcare provider to determine the best course of treatment for your individual needs. What are the treatment options for pernicious anemia? The treatment for pernicious anemia typically involves vitamin B12 injections, which can help to increase your vitamin B12 levels and improve your symptoms. In some cases, oral supplements may also be effective. Additionally, if the underlying cause of your pernicious anemia is related to an autoimmune disorder, your doctor may recommend immune-suppressing medication to prevent your immune system from attacking your stomach cells that produce intrinsic factor. It's important to note that while treatment can help manage the symptoms of pernicious anemia, it cannot reverse any nerve damage that has already occurred. Therefore, early diagnosis and treatment are crucial in preventing long-term complications. Moving on to the sixth popular question, can pernicious anemia be cured? Unfortunately, there is no known cure for pernicious anemia. However, with proper treatment and management, most people with the condition can lead normal, healthy lives. Regular monitoring of vitamin B12 levels and following a healthy diet can help prevent complications and keep symptoms under control. The seventh popular question is pernicious anemia hereditary? While genetics may play a role in pernicious anemia, it's not a straightforward inherited condition. Rather, the condition may be caused by a combination of genetic and environmental factors. If you have a family history of pernicious anemia, it's important to talk to your doctor about monitoring your vitamin B12 levels and potentially testing for the condition. Moving on to the eighth popular question, can pernicious anemia cause depression? Yes, pernicious anemia can cause depression and other mood changes. This is because vitamin B12 plays an important role in the production of neurotransmitters that regulate mood, such as serotonin and dopamine. If you're experiencing symptoms of depression or other mood changes, it's important to talk to your doctor about getting tested for pernicious anemia and starting treatment if necessary. In the next section, we'll discuss the ninth popular question, can pernicious anemia cause weight gain? And provide more information on this topic. The relationship between pernicious anemia and weight gain is not fully understood, but some people with the condition may experience weight gain. This could be due to a slower metabolism caused by the lack of vitamin B12, which can affect the body's ability to break down and use calories. It's important to note that weight gain is not a common symptom of pernicious anemia, and there are many other factors that can contribute to weight gain. If you're experiencing unexplained weight gain, it's important to talk to your doctor to rule out any underlying medical conditions and determine the appropriate course of treatment. Moving on to the 10th and final popular question: how long does it take to recover from pernicious anemia? The recovery time for pernicious anemia can vary depending on the severity of the condition and how quickly it is diagnosed and treated. With proper treatment, most people start to feel better within a few weeks to a few months. However, some people may experience long-term complications such as nerve damage or cognitive changes that cannot be fully reversed. It's important to continue treatment and regular monitoring of vitamin B12 levels to prevent complications and maintain good health. In conclusion, pernicious anemia is a serious condition that can have a significant impact on your health if left untreated. It's important to be aware of the symptoms and seek medical attention if you experience any of them. With proper diagnosis and treatment, most people with pernicious anemia can manage their symptoms and lead normal, healthy lives. Don't forget to subscribe to our channel for more informative videos on health topics like this one. Thank you for watching.